Jordan, let me know when you're ready for me to start. When we've got everybody in.
We can get ready in about 3 minutes or so, Wendy, if that works for you.
Perfect. Perfect.
That way, people.
For those of you just joining, we'll be getting started in just a second. We're just putting our CME information up, so stay with us.
Okay, it looks like everybody has come in now, so we can go to the...
Please go ahead and text your attendance right now so we know that you're here. Please make sure to mute your mics. If you can, put your cameras on. We would love to see your faces. And then questions in the chat, we'll make sure that we get those questions answered. All right. Good morning, everybody. Welcome to our webinar. Today, we're going to be talking about from impact to induction, driving influence in addictions nursing. My name is Dr. Wendy Williams-Gilbert, and I'm thrilled not only to be your moderator for this session, but I'm also a FIAAN. And so for the next hour, we're going to answer all the questions you may have or didn't know you had about becoming a FIAAN. Today, we'll take a deep dive into what it truly means to earn a fellowship in the International Academy of Addictions Nursing. It's not just a milestone, it's a standing commitment to visionary leadership, mentorship, and advancing addictions care globally. For me, it was an amazing part of my career, and I still remember my day I was inducted. Over the next hour, we'll hear from 5 distinguished leaders who embody this mission, 3 who are newly inducted into the fellowship, and 2 senior FIAANs who have been leading the charge for over a year. Let's introduce our panel. Would each speaker take 5 minutes to share who they are, what they do, their journey to induction, and their personal value proposition as a fellow? And we'll go ahead and we'll start with Adrienne, who currently is our president-elect.
Hello, everyone. Yes, I'm Adrian. I'm the president-elect for IntNSA Global. My journey to where I am now has gone in different directions. So, in the UK, we don't we when we qualify, we have to choose whether we're going to be adult, mental health, child, or learning disabilities nursing. A majority of nurses go for the adult route, and that's what I did. And I started my journey in cardiology and acute medicine. And even at that early age, I realized and identified there are individuals who perhaps had been drinking too much, or occasional drug use, or even long-term drug use were coming into these areas. So I remember in cardiology, individuals who had bacterial endocarditis due to injecting drugs. And then when I moved to acute medicine, the amount of collapse query cause, and then they start seizing. So it was always there. I then did my mental health training on top and then worked in a drug and alcohol agency, which was probably a community focus that you have, but Monday to Friday, 9 to 5. And I did various different jobs. So screening, titration of methadone, titration of buprenorphine, hepatitis clinics. So as I was also a nurse practitioner at that time, so there was also the physical stuff I was doing. And at that point, I realized that I'm probably more an adult nurse with a mental health hat or a generalist who likes addictions. And in that way, wherever I've gone in my journey, which would have been hepatology, acute medicine, uh, liver disease, alcohol and drugs have always been there. So that's where I started from. But in 2000 and I think about 11, a group of American nurses came over to London and I got invited over. And that's where I met members of INSA. Um, they'd newly become international, but they'd come over to the UK to do a group session on drugs and alcohol. And my nurse leader dragged me along to it. And I mean, dragged me along to it because he found me in the car park on the way to work. He says, "What you doing?" "I'm going to work." He goes, "No, you're not. You're coming with me." So opportunistically. And then that's where my journey in INSA started. So I knew of the group, but didn't realize I could join. And then again, it was when INSA went to Rotterdam for the ICAN conference. Um, I was invited to go along as well, and then I met more of the INSA crew, and I think that might have been in February. Dana Murphy Parker said to me, "I'm doing a presentation on nurse education. What are you doing in April, May?" I said nothing. Basically, she said, "Come along, you can present with us," and that's my first conference. So again, opportunistic. Um, so the question is, when did I think I should become a FIAAN? I don't think I did. And I think it's when people push you to say, "You've got experience, you have got credibility, you're doing things that are different." So that's the nurse prescribing or the hepatology clinic. And it was more of a push to say, "Well, you meet the criteria, put your application form in. Um, we'll see what happens." And then that was it. I got myself in through many opportunistic opportunities. So, as I said, um, drug and alcohol in clinical situation, then meeting American nurses and having a discussion, then opportunistically being invited to go to Rotterdam, and then going to Denver for the first conference I went to. And I think from that point on, you start meeting people and you start making relationships. So Instagram was the way that I kept in contact with some people. And I think for me, advising people to join, that's the way that I would often get in contact with people saying, "Well, you're doing wonderful work. Have you considered joining?" And then once you get to know them, would you consider then coming into the fellowship? So that's my journey, but I know I'll be talking more later on. Thank you, Wendy.
Thanks, Adrian. All right, we're going to go from England all the way over to Oregon. So, Jordan, we're going to pop over to you.
That sounds fantastic. Hi, everyone. I'm Jordan Ferris. I'm a nurse, a researcher, and a faculty member here in Oregon at Oregon Health and Sciences University. And as Wendy just said, I'm one of the newer FIAAN fellows. I was just inducted at this last conference. My path to addiction nursing was definitely not something I planned from the beginning. I was not the person who graduated from nursing school thinking, "I'm going to become an addictions nurse researcher." I really found my way here through practice and through a lot of the people that I met along the way. I worked in a variety of different areas of nursing, but there was really just some point where I started to be really interested in substance use, and particularly in the way that we as nurses and healthcare systems respond to people with substance use disorders. I became really interested in stigma and policy and regulation and all of those things happening around the individual person that have a really huge influence on whether someone actually has the opportunity for a recovery. And then I found INSA. I still remember going to my first INSA conference and thinking, oh my gosh, these are my people. It was beyond amazing to just be in a room with all of these people that I didn't have to give any context to what I was excited about and what I was talking about and what I was researching. These were all of the same people who cared about the same things that I cared about and were asking a lot of the exact same questions that I was asking. I met people at that first conference who are now some of my closest friends and who are in this webinar right now, and as well as collaborators and mentors. And that community has been a really important part of my journey, both professionally and personally. As I moved into my PhD work, my interest became a lot more focused. My dissertation looked at nurses returning to practice after substance use related licensure action and regulatory monitoring. I really wanted to understand what happens when a nurse is in recovery and is trying to come back into the workforce. What makes that possible? What gets in the way? And what could our systems be doing differently? And that project really shaped the researcher that I've become. My work started out being very specifically about substance use within nursing, but over time that question has gotten bigger. And now I really think about my research as asking what happens to people with substance use disorders when they encounter the systems that are supposed to care for them, regulate them, and support their recovery. That's taken me into research on nursing regulation and discipline, recovery-oriented regulation, workforce prep, and workforce participation, emerging substances, and how prepared nurses and healthcare systems are to respond to those changes in substance use. And they can look like very different projects on paper, but for me, they all come back to that exact same question about how systems respond. My journey to becoming a fellow was also a little expected because I wasn't really sure that I was ready to apply. I had this idea in my head that fellowship was something you did much later in your career. I'm relatively early in my academic career, so there was definitely a part of me that thought, oh, maybe I need a few more years, maybe I need a few more publications, maybe I need this one more big thing. And what helped me was stepping back and looking at this whole trajectory instead of looking for that one singular accomplishment that would suddenly make me qualified to be a fellow. When I did that, I could really see that there was this really amazing, productive, interesting thread that was running from clinical practice to advocacy to my doctoral work to research and education service, and then my involvement with INSA. And it made me realize that the application wasn't really about proving that I had arrived somewhere. It was about showing that I had been contributing to addiction nursing over time, that I intended to keep doing that. And I really think that's what I bring to being a FIAN. So my perspective is very systems focused. I also bring this perspective of somebody who's still fairly new in their career. I have a tremendous amount to learn from the senior fellows, and that's something I'm genuinely excited about. But I think being a fellow means having a responsibility to contribute now, whether that's through research, collaboration, mentoring students and other nurses, or helping bring newer people into the community. And honestly, that community piece is probably what FIAAN means the most to me. I really came to that first INSA conference and found people who became my colleagues, collaborators, mentors, and like I said, some of my best friends. And so becoming a fellow really feels like another step in that same journey. It's an opportunity to really be a part of this group who care deeply about addictions nursing and to think globally about what we can build together.
Thanks, Jordan. That was great. All right, now we're going to pop back over to the East Coast to Kathleen. And then after you, Kathleen, Chandra, we'll let you bring it on home.
Oh, welcome everybody. My name is Kathleen Elliott. I'm a faculty member at the University of Massachusetts, Dartmouth. And my journey into INSTA was in 2015. I was finishing my doctoral work and presented at INSTA. And it was then I really got introduced to people in INSTA. Incredible. And I felt really heard and understood. My project, my doctoral work required I looked at stigma in nurse practitioner students. And I had really had a lot of obstacles in order to do my doctoral work. And then I presented and I met a lot of people. And within that conference, I met Dr. Dana Murphy Parker, who introduced me and wanted me to actually do a research project. That was like 5 years ago, but it was a big lift. And I've been working on it since 2015, and we just got IRB approval a year ago. And at this point, we're actually doing it and implementing it. And if I wasn't introduced to IntNSA, I wouldn't have been able to do that. And I've had the opportunity to meet many people, many nurses from all different countries through this organization. It's been great. Just to briefly go back, I worked in the emergency room for over a decade as a nurse practitioner and really became interested in, I was traumatized by the way we treated people in the emergency room. And that became my passion to actually study, look at stigma in nurses. And particularly we're doing a study on the stigma of nursing faculty. But within my work, I've sustained a service learning project where all adult nurse practitioner students have to go to do hours at a methadone clinic. And when I presented what I was doing, I instantly developed so many friends at the conference, and we became friends. And I'm continuing to make friends. And I'm also a board member and a FIAAN. And it's through that work here that being a fellow is really about continuing to move the momentum forward, especially when we talk about substance use disorder, both in the US and internationally. And I've been humbled to meet so many people from other countries with a lack of resources and what they have been doing to actually stop the stigma in their own country with little education. So, being a fellow means working with other countries and continuing to develop our organization. So thank you.
Thanks, Kathleen. All right, Chandra.
Hey, I'm Chandra Spate. I'm a faculty member. I'm a nurse practitioner and a faculty member at East Carolina University in North Carolina. And so I didn't go to almost anything in my life in a straight line. I started out as a as an English teacher. So I was an English teacher and a political science teacher for about 10 years. And I have a master's degrees in both. And I kept getting pulled. I just had this feeling that I was really meant to be a nurse, that I was not doing the right thing. And so finally, I quit my job as an English teacher and I went back to school to be a nurse. And in my nursing work, and I've heard this in some of you, I found myself very sort of traumatized. I love the word Kathleen used by how some populations were treated, and this was one of them. And it was kind of in the back of my mind, but it hadn't even risen to the front. Even when I decided to do a PhD, I was really kind of, even when I started nursing school, I think really down the line, I probably want to be a teacher and I probably want to engage in nursing science and move that forward. And then I started working as a nurse practitioner in a hospital setting. And I was, again, just really drawn to this population. And I remember so distinctly sitting in our morning meetings and people arguing over who wasn't going to take the patient that was there for a substance use related disorder. And I was like, give them to me, just like, stop, just give them to me. I will take care of them. And I get chills even thinking about it now because it was just so disturbing to me and I'm sure this resonates with all, any of you, that this was the population folks didn't want to take care of, and it was just somehow in our gut just bothered us. So that was the beginning. And then, like I said, I had this degree in political science. And so I was really interested in the way that we regulate medications for opioid use disorder. And so, as a nurse practitioner, I couldn't prescribe buprenorphine, and I was seeing patients come in who were using this medication and having really great outcomes. And so, my dissertation was around nurse practitioner buprenorphine prescribing. I live in an extremely rural area. Nurse practitioners provide most of the care where I live. And so I wanted to understand now that in 2016, when the regulation had been lifted, what sort of barriers nurses were experiencing when they went to prescribe these medications. And that was the beginning. And I first learned about IntNSA looking for some place to present my dissertation work. And so that was the, first way that I engaged, and the paper was accepted. And then, just like Jordan said, immediately felt a good fellowship, developed relationships just very quickly, because the comment that there was no context required, that there were people who, even if they weren't interested in the exact same question you were interested in, these were folks that valued those questions. And so that was important, and folks that could listen to my questions and help me think about a better way to approach them or address them or things. So it was just a nursing community that I found. And so I decided, early on, I started realizing that a lot of the people who were fellows were people whose work that I had read about and respected. And so I thought I wanted to be a fellow. And at the same time, I was on tenure track. And so I needed to and wanted to develop a body of work and sort of think about how my work would move the science forward. So that really paralleled perfectly with what you're asked to do as someone who's applying to be a fellow. And so, I wanted to be a fellow. I wanted to be part of that community. I wanted to engage at a different level with the nurses internationally who were involved in the organization. I felt that I had something to offer them, and they would likely have something to offer me. I feel like it's a way also to, I think it's important to be a member of the organization and be a fellow, to take that back to your organization, to kind of show your organization what nurses are doing at an organized level around addiction, not just nationally, but internationally. And so that was important to me. So that's how I wound up here. And I appreciate you asking. Thank you.
You're welcome. We're gonna have some different categories that we're gonna go through as we ask all of our FIAANs some questions. And so the first one's gonna talk about the induction journey and overcoming challenges. Each of you touched on little pieces of this next question, but I want you to think about, the FIAAN application requires applicants to articulate evidence of sustained impact over time. It's not just a one-off project. How did you organize your CV and your portfolio to clearly demonstrate this multi-year arc of achievement? And like I said, some of you sort of did touch on that, but if you could provide a pearl or two of wisdom of how you kind of got your stuff ready to go so that you could really highlight the work that you were doing.
Can I jump in and say, I think that one great thing is that, if I can bring you in, Jordan. So Jordan and I, at our first IntNSA conference, we met and just, really almost instantly knew that we were not just going to be colleagues, but we were going to be friends. And this was a goal that we had together. And so we supported each other. And I had, because I knew this was, not, it wasn't something I wanted to do to check the box. It was something that was genuinely important to me. But I got the criteria, and we both had the criteria, and we were looking at, what do we need to do? And again, we knew also that doing those things was what would position us to make a difference in our research fields, in policy, and all of those things. So I think that advice would be for someone starting out, go to a conference and make a friend. Would you agree, Jordan?
Yeah. These are your people.
Mhm.
Come make friends. Well, I mean, since you went ahead and popcorned off me here, Wendy is one of my former professors. So being able to meet her and spend more time with her and really see the passion that I didn't see in the class that she taught us because it was this totally different thing, but to see this other side of Wendy was amazing. And now, Chandra and I are doing multiple projects together. So she and I and Wendy and I and Adrian and we've all really taken the fellowship part to heart and have made the organization what we really want it to be for ourselves. And that's been super amazing. I was busy listening to Chandra though, and I completely forgot the train of what the actual question that you asked Wendy was. So if you could repeat that, maybe I could speak to that a little bit more eloquently.
Yeah. How did you organize your CV and portfolio to clearly demonstrate the
Gotcha.
multi-year arc of achievement? And you spoke about it a lot on your
A little
introduction
bit.
too, but I would
Yeah.
love to hear more.
Um, I really had to find the thread. I think I said that in my intro, but I had all of these sort of like one-off things or what I thought were really one-off projects, that I really had to sit with and find how they fit together to create this story of who I was, of what I was doing, and really of where I wanted to go. So I stopped really looking at publications and presentations, and service and advocacy as separate accomplishments, and really identified the larger story that connected them. And for me, that thread was substance use recovery stigma in that systems response, that began in clinical practice and that was really developing into research and scholarship. I also really tried to show progression rather than repetition. So really showing that one project leads to another question, and then dissemination really created this collaboration. And then that evidence really began influencing, the pillars of education, practice, and or policy. And then finally, I would ask yourself when you're putting it all together, can the reviewer see what changed because I did this work? The impact matters more than simply documenting the activity. So really make sure that you highlight that when you're putting your portfolio together.
And I want to just touch off something that you said, Jordan. I think many people get really caught up in this idea of publication and publication. I don't have the world's longest CV around publication, but I do have a lot of, my CV is very big on community presentation and really presenting on statewide work and really working with multiple agencies from a statewide perspective. So if you're sitting here thinking, well, I don't have 1,000 publications, but maybe you're doing work in your community and beyond that's really impactful, that, in my opinion, is really important. And we look at that in the FIAAN review, because you can write an article and get it published, but that doesn't necessarily mean that you're impacting your community. And I think I can speak for every single person here. We really are focused on making a change and not just talking about making a change. And that's one of the things that it's hard for me just to keep my mouth shut right now because I'm so passionate about this work. And Kathleen has talked about this, and Adrian, it's impact that's happening regardless of what countries you're in, right? So we're all coming together and really this global impact. It's pretty powerful when you see all the presentations come together.
Yeah, I think when I submitted my application, I think I actually had two publications that I was a first or second author on, and then I had something that I was like 17th author on. So that was part of Chandra and I talked to each other the whole time through this whole process, because again, she said it was our goal from that very first IntNSA conference to be able to go up and be inducted at the same time. That was very, very important to both of us. So I leaned into the fact that I'm on the board of directors for the Mental Health and Addictions Association of Oregon, that I am the person at OHSU to come and do all of the substance use lectures, and that in the clinical that I was teaching, I went ahead and made community partnerships with two agencies that service houseless folks with co-occurring mental health disorders in the Portland metropolitan area, and was taking my students there and forming those relationships and completely changing how students were thinking about these populations and engaging with them. So that was actually the bulk of my application. It wasn't scholarship.
Mm-hmm. Thanks,
I'm going to say the
Jordan.
same thing. I think often people consider that the fellowship you've got to be a top academic, and I don't think that's true. I think you can show your relevance in different ways. I like what Jordan just said about community. I was just looking through my CV. Yes, there's lots of drugs and alcohol in there, but there are projects that I presented to the hospital, or change of practice which I was involved in. So again, if you can prove that you are empathetic, you understand the population, you understand struggles. I think Jordan and I often talk about systems. I think that's easy for us, but there are other parts of addictions that you can look into. Um, Small conferences where you could present on, what have I got here? How education doesn't really teach addiction. So therefore, no matter where you are, you often feel as if you're not prepared. However, the population is there all the time. So those small things can be done. Posted presentations at conferences are all really good. But I think what Jordan and I and everyone is saying is it doesn't take much to knock on a door and then someone goes, "Oh, come and join our group." And then you're there for 2 years and then you've realized you've impacted on this. So for me, all of those little things should go in your CV. So I've got things such as full nurse member in a group. And then I got ex officioed into a subgroup, which then puts that on my CV because that was good. Um, Even if you become a peer reviewer and you review a few drug and alcohol ones, that tells me that you're an expert in the field because you're reviewing one of your peers. And you don't review to criticize, you review to say, actually, that's really good, but have you considered this? And that makes you realize that actually, I do know what I'm talking about. So those small things need to be in your CV. And I think the thing has gone that you're not very few people start in a job at the age of 20 and retire 60 in that same profession. I think we've all become portfolio academics or practitioners. Chandra, teacher, been to UK, taught all these other things. These are good because it tells you work with people, you know how to understand people. So I think when it comes to your CV, amplify all those things that you've done, no matter how small you think it could have been. If you're presenting it, there's impact there. Impact doesn't mean um, changing the world. It could just be writing a policy in your local area that has improved either quality or outcomes. Those are the small things we can work on.
Mhm.
I'm going to be quiet in a minute, but the previous FIAAN secretary, Dr. Kim Dion, who's may not be here, but will probably be watching this later on. I remember having a text message conversation with her late at night, and the one thing that she said that sticks with me with every single discussion I have is practice influences research, research influences practice. So you can jump on board that merry-go-round wherever you want. And if you can see a change or make a change, that's all we're really looking for. Because I think that tells you got your teeth in it. I don't like what Jordan says. I don't think many people register or get their license as a nurse and says, "I'm going to be an addictions nurse." It's something you fall into. Um, I was privileged because my dad did it before, and I wasn't planning to do it. And in my mental health uh, course, my last placement was where he worked. And I said, I can't do that because all these issues. So the consultant of the unit says, I'll take him on. So if anyone looks at it, that's fine. 9 week placement. I had opened and shut so many cases. I'd referred so many people on. Those were my people. Um, it doesn't take a lot for you to go, I understand what you're going through. That must be really challenging. And then when you listen to the story, you realize how many doors have been shut on them, either because of systems, or lack of information that we've given out, or that people just see them as, what's the point? So again, uh, all of that can go onto your CV. The global ones take a little bit longer, but you've got to start somewhere. I think community or in your hospitals, and then progress that along. And I think, like Jordan, well, no, Jordan talked about publications. I'm not a big, I don't generally write that much, but if someone says come and write a chapter in a book, and you're going to focus on alcohol, that's something good. I know I need to finish one off, but it then tells you that you've got reputation because someone's come to you to say, "Oh, we're looking at this. Can you write something?" So again, I know it's difficult, but if you need to take the opportunities, and I know it's going to be challenging, it's tiring, but if you do that a couple of times, your CV will have um, a chapter in this book, chapter in that book, and you've done a research paper, or you've been, as Jordan said, the 17th person in on a list, but your name's on there. So again, that's for me. Start small, but don't forget those kind of things.
All right, Kathleen, I'm going to move us along just a little bit because we do have a lot of questions to go through. Kathleen, could you take the lead on this next question? How did you know you were really ready to apply? Was there a specific benchmark, milestone, or piece of feedback from a mentor that signaled it was time to submit your application rather than wait another cycle?
I think for me, I went to a couple conferences and I presented, so I was lucky in that regard. When I actually saw and I was a member, I saw the criteria, I knew that I had met it. And I think because, I think it wasn't so much the research, even though I have done research, but it was the courage. It was a lot of courage to be an addiction nurse. It wasn't easy. So once I read that criteria, I knew I fit it and I wanted to apply because we need people who are fellows that are courageous. And if you are an addiction nurse, you are courageous and we need you. I hope that answered it.
Anybody else want to add anything to that before we move on to the next question? All right, moving on. Not everyone passes on their first attempt. For candidates who might need to refine their submission or strengthen their evidence, what advice do you have for utilizing feedback from the review committee to build a stronger resubmission?
I'm happy to take this one. Like I alluded to it in my first response there, but separate the I don't have the evidence from the I didn't communicate the evidence effectively, because those are two very different problems. And then treat that committee feedback as a roadmap. Intentionally use it for the next cycle to address those areas that the reviewers identified. I would also highly suggest finding your people. So finding your mentors or some of us fellows and asking them, can you see my impact? Can you see that it's sustained? And can you see who or what changed? Sometimes, with all peer review stuff, it's hard to see your own blind spots. So if you can ask somebody else to take a look at it who knows exactly, or at least has a better idea of how to answer those questions, it could be super, super helpful. And then finally, an unsuccessful application, it does not invalidate the work. Please don't ever think that. It just means that it gives you information about how to strengthen either the trajectory or really a lot of times it's how you communicate it.
I think you make a great point, Jordan. I think most of the time it isn't that you're not doing the work, it's that you haven't articulated that. And it is hard. I write and I don't articulate well enough because in my mind I think, oh, it's easy. You can see it on paper, but really it's presenting that evidence in a way that people can see it. Jordan, what were you, or Adrian, sorry, what were you going to say?
Yeah, I agree with Jordan. I think nobody likes being knocked back, but the feedback should be constructive. And I think most of the time is we know that person is doing some good work. Where's the evidence? And it's as simple as that. So perhaps articulating more on why and looking at the criteria for what the key words are. And again, this is a closed group. We know that. We know we're passionate about it. the feedback may be, look, focus more on this, or explain how you're communicating to students or junior nurses. That could be the thing that we're looking for to elevate you or push you over that line. Yeah, I think being knocked back for anything doesn't feel good, and I think the cycle takes a long time. So you're going to have to wait another year to come back round. But use that opportunity. Contact members, contact the FIAANs. Can you guide me? Can you tell me what am I missing? And often, as Jordan rightly said, you're not missing much. It's just you didn't make it clear enough in the application form, because I think Wendy, Jordan, and I know that as individuals, a lot of it's in here. It's just getting it down is the issue, or getting it down in a way that someone else can understand. And I think that's perhaps key. So again, yeah, we want you. We like you. It's just showing the evidence in a way that goes, oh, we like this person. We want them.
If I can
Thank
just
you.
add to that, I mean, it's just a practical thing, but Adrian talked about remembering all the little things that aren't really little, but it's just so hard to discipline yourself to always add things to your CV. I mean, because it's just like while we were waiting for this to start, I just copy pasted this and stuck it in my CV from the email. So I'd remember, because I know I'll forget. Because I think a lot of us do a lot of unclaimed work. The time the health department said, hey, can you come by for 30 minutes and talk to the staff about this? And you just don't really think about, oh, that's a presentation. Like, I need to remember that. And those are, I mean, as one person alluded to, like, I mean, that could be bigger than, I mean, a policy change, a conversation with a group of nurses. That impact can just ripple and be huge.
Thank you. All right, I'm going to move into our next category, and we're going to move a little bit quicker on these questions, but I think we've answered a lot of the questions that are coming. But mentorship, legacy, and sustainable leadership. And for the senior fellows, fellowship is described as a standing commitment rather than an end of career accolade. How has your responsibility to the specialty evolved since your induction, and particularly regarding mentorship as a FIAAN?
So being a FIAAN, you can use the post nominals in your work. So I think number one, if you've got it in your title, you've got to justify it. And all the meetings I go to, people are probably tired of me of saying that we need people to prove that they're still valid in that role. But I think it's important to understand that the fellowship it's a journey. It's not actually saying that you've got there. It's about proving that you are going to be that leader. Leadership can be anything. So I'm not going to go too much into what leadership can be, but you are there pushing the boundaries to educate, to improve, to advocate for, to challenge where things may or could be improved. In the UK, we had a really big issue looking at how nurses behave, and they came out with 6 statements or 6 pillars. And one of them, that the one that I always stick to, is if you're going to be a fellow, you have to be courageous, because you are the one who's going to be the advocate, who's going to say yes or no against certain things. And that could be either being policy, or that can be you, the nurse on the ward, saying, actually, I don't think this patient can go home yet because of ABC. Can we have an extra 24 hours? That is what I think the fellowship means. Because if you're going to put that title to your name, I'm not saying you have to work for it. I think you need to prove that you're still doing it. I think nurses do work hard, but it goes back to what Chandra says. We forget how good we are and don't pick up those little bits of information. And then we don't record it on our CV to say, well, I did that. So for me, it's about being courageous and being that advocate. So whether that's writing papers, changing policy, being a member of a group, and being the one who talks about I don't know, admission, treatment, whatever, when it comes to addictions, that's how you prove your worth in that role. So again, for me, it is purely about the first step is getting the fellowship, and then the hard work comes in. But then you have great people in the room. So Jordan and I have had conversations about what will our next conference piece be, because we seem to like the same area. So we seem to Jordan goes first and does a point of view, and I'll do juxtapose and do the other. So again, we are doing that. Time difference is 9 hours. We make the opportunity to plan, discuss, but then when we meet up at conference, we do our presentation. So just to blow our own trumpets, this year was to talk about why are nurses put into the position of angels, or but they're actually just humans. Why are we putting nurses on that pedestal? And we looked at it from an ethical point of view. So Jordan looked at it from a licensor point of view, and I looked at it from the classical ethics point of view. And I think we both came up with the same answer, that ethics are important, but we do put nurses on quite a high pedestal, and we should really respect them as individuals because they have their own life as well.
Thank you, Adrian. I think there's another side of this question too that I'm going to jump in, is that FIAAN isn't one and done. And I think that you have a responsibility not just to your community that you're coming from, but also to the other FIANs to be present and to be a part of this community. And so it's important that as you're thinking about sustainable leadership and legacy, that you're also still participating with the FIAN groups and with the meetings and engaging together, because oftentimes we need each other, but we also have a lot to contribute to the group, right? There's also work that needs to be done. There's work that needs to be done from an organizational standpoint, and we need our FIANs to be really leading some of that work. So I think it's important to not only, continue to lead in your community, but to lead with each other. All right. Any other comments from anyone before we move into the next question? Here's a question I think any of you could answer. How do we cultivate the next generation of addiction nurse leaders, especially in regions or health systems where addiction nursing is underrepresented? And I would even say, especially in countries and in different parts of the world, how do we build the sustainability or build the FIANs in those regions?
Sorry, I'm going to jump in again. I'm the outsider. I'm the one across the pond. I think it's understanding that systems are different. I think we've all gone through our own journey. But one thing I learned coming to conferences is the US is very different from Europe. And I think for you guys who have the misfortune of having me in meetings, I do talk about other cultures. We need to be empathetic to different ways of working. So it's about opening up your eyes to what is going on around the world. I think it's about also not saying that we are the experts. I know I've got Valentina in the room here. We have conversations because she's in Croatia about how can I support her and she supports me. But I want to try and have that level playing field, because I don't know what it's like in Croatia, but Valentina, I've had conversations, text messages, we've had Zoom calls, and we try and support the best we can. And I think that benefits the organization. Valentina and some of her peers came to our conference, and again, they are looking at trying to improve addictions nursing where they are, but also trying to get more members as well. So I think it's about being open and understanding that things are different in different areas. And I listen to it when I come to the USA. Oregon's different from Massachusetts. I think acknowledging that we are different. I don't think the right thing to do is to stand up and say, I know it all, because I think conference teaches you that we don't know it all. There are other people in the room who've got different opportunities, experiences, challenges, and that's how we learn. So for me, I think it's just being open and acknowledging that we only know a small part of this.
Thank you, Adrian. We're going to shift a little bit and moving into the 5 pillars. So the FIAAN Assembly drives progress across 5 key pillars: practice, education, research, policy, and administration. Could each of you share one example of how your work has advanced one of these pillars on a regional or an international scale? And I'll start with practice, because one of the things that we've recently implemented where I work is our transition to practice for new nursing grads. We've added addiction at the same level that they have to do cardiovascular health, respiratory health. So we don't see addiction as this other thing. It's like, these are the foundations you need to be a med-surg nurse working on the floor and to practice as a med-surg nurse. You need to understand addiction nursing just as much as you need to understand cardiovascular or renal nursing. So that's one of the things I think that's been me from a practice standpoint, then to see the nurses on the floor asking those questions that they may not have asked, 6 months ago. Who would like to go next about one of the pillars? Chandra, am I saying
Yes,
it wrong? I know I
Chandra.
keep saying Chandra.
I'll go with education. I've worked really hard to integrate substance use disorder education in our nurse practitioner programs and have a SAMHSA award where we do it with our dental students, our med students, and our nurse practitioner students, and we train them together, which is really exciting. We had a regional conference this past year, which was the first conference in our region where we paid for practitioners to come in and registered nurses to come in. So I think that integration, just like you said, Wendy, it's that we start treating substance use disorder education as something not that you learn at the very end in a class, but that's something you learn from the get-go. And we're also, like Kathleen, we're sending students. Most of our students are spending at least one morning in a methadone clinic, which I'm really happy about. And I think that's really important, and our funding allows us to do that. So it's education.
I'm going to do policy. So I'll start with small policy and the big policy. When I was working clinically, I worked in the emergency department, but was the addiction lead for nursing there. And actually, I became the addiction lead for the whole hospital. So post-take ward rounds, I would go to the meetings and I would work with a consultant. So that's the nice bit. The funny bit is when you are advocating for your patient and you're ringing the junior doctor to say, can you do this, this, and this for me? And they go, well, I can't, I'm going to have to go through the guidelines, and the guideline says this, this, and this. But I said, I wrote the damn guidelines. So one, that's small. So that would be things like increasing medication for detox. That number one. I've been involved in developing national standards for the treatment of alcoholic liver disease and end of life. So that's a national one. Challenging again, because what you realize is, again, go back to what I said before, you know nothing. Once you're doing those groups, you have academics, you have researchers, you have statisticians, you have clinicians, and then you have patient's voice. And I think that grounds you as well. So that's a national one. And then I was involved in the European one about liver disease as well, and making sure that we get the right treatment in within the first hour for anyone who's got suspected acute liver disease due to alcohol. So I've got hospital, I've got national and international as well, which I think only happens if it goes back to my idea again, knocking on doors and trying to say, can I join your group? Because it will be a consultant saying, oh, there's a position for a nurse on this group. Do you want to come along? And that's for me how you get those things so opportunistically.
Thank you. All right, we have research and administration, which I feel like Jordan or Kathleen could both talk almost about either one.
Yeah.
I definitely can't talk about admin. So Kathleen, if you want to take admin.
Admin? I mean, I don't know if I could take admin. But
admin's
I
a quick one. Sorry, I'm going to jump in. I'm going to jump in. Admin. So when Chandra mentioned about people using the standard, you're the one who's putting that nursing, you're the one who's putting that information into a patient's journey. So again, it's about, if you're going to screen somebody, screening's got to be across the board. So policies, admin, how many screenings have been done, how they've been put together, how they've been added, and then it goes to hospital records. So I think I found the underrepresentation of people with liver disease, alcohol-related issues was not being counted. You can only do that if you're looking at admin, because admin is paper. Paper is counted, and that gives you resource and evidence that you need. So sorry for jumping in there. I think that covers the admin part in a clinical way.
And I think with my research, I had the opportunity to do this international study, which has been really humbling to meet nursing faculty across the world and see, we're looking at nursing faculty stigma. And as a nursing faculty, I've been working on this for a while. It's been humbling. And it's also been it's been an honor to meet other faculty who are working and being creative and doing amazing work despite many obstacles and barriers. So it wouldn't, if I wasn't a fellow or I wasn't in this organization, I wouldn't have had that opportunity.
Do you want me to say something or do you want to move on? I feel like it's all been covered.
Okay. Well, then you know what? I'm going to give you guys, we're getting close to the end, but I want each of you just to give me one word that describes what being a FIAAN means to you.
Oh man, one word. I had a sentence prepared, but one word is fine.
All right, you can do your sentence. We could do one sentence or one
Okay.
word.
So for me, the one sentence is that you have to shift. And the shift is from asking, how can I do this work well? Which is what a lot of us as researchers and clinicians do. How can I do this work well? To asking, how can I change the systems that determine whether this work is done well at all?
Yeah.
I would say it's about asking those questions. It's about being annoying in meetings. I think if you go into a meeting and you say, but what about this? I think that's the important thing. We've got to challenge each other respectfully. We've got to challenge the organization. And I think we need to challenge practice as well. I think the good thing about being a FIAAN is you've got the platform to do those things. And I think the other thing that's really important is you've also got someone else who's got the same idea. So you're not in that silo. So I would say it's going to be about challenging. You have to challenge to keep going forward. And I think our group, I don't know how many are in there now, it's 50 or 60. Those meetings can get heated, but it is all for the benefit of that person who is looking for services or is involved in treatment or is looking for recovery. We are all advocating for them.
And I would say, because I'm going to keep it concise, for me, as a FIAAN, I am a stakeholder, right? I advocate for these patients, but the biggest thing to being a fellow is sustaining my creativity. And that creativity that you get from being a fellow and being a part of this organization.
So I am going to give one word, change. I think it's about change, that we're all somehow dedicated to change and changing things for the better.
And I would say community. I feel like this is a community that I can grow and be myself and make mistakes and still move forward. And I think it's hard to find those communities. So I did put a question in the chat for all of you who are watching today. You have some homework, because what would we be if we didn't give you homework? But I want you to think of one actionable step you can take this week to get you closer to become a FIAAN, whether it's as simple as updating your CV, downloading the standards so you can see what you need, reaching out. Anybody on here, any of us would be happy to have a conversation or mentor you, but I want you to commit to one thing this week. And I don't know that we have any questions in the chat, but feel free to offer any questions. And please, I hope all of you that are here today, we see your names in the application pool, because we would love to see us grow, to get more diverse people from all over the world, not just the United States. I mean, I think we are really committed to truly making this global, and then understanding that we're all working together regardless of where we live. The application will be open October 1st and it goes to January 31st. So we'll be doing a big media blitz here coming soon about applications and getting them out. So you still have time. I'm looking over at my wall calendar. So there's still plenty of time to get to be thinking about that. It's also plenty of time to reaching out to a mentor.
And I just want to say, please come to conference and find me
Yes.
and say hi. And I want to meet you and I want to know you. And I want more conference friends all the time and more collaborators. I love working with other people outside of my organization, outside of my country. Please, please, please come to conference. Please be my friend. And let's do really wonderful things together that transform the field of addictions nursing.
And with that, I can't think of a better way to end this presentation than with those words. Thank you all so much for showing up.